A lot of people don't know this, but TMJ pain is the second leading cause of pain in America behind lower back pain. The average amount of time that someone is in treatment for TMJ symptoms can be up to 109 months. That's the average.
Yeah.
If you're coming into me complaining of jaw pain, I'm going to ask you how your sleep is. I'm going to ask you if your partner notices it. Are you snoring? Are you waking up with a dry mouth? Like, all those questions come into play here, because we all know if the sleep's poor, our outcomes are going to be poor. When someone tells me, like, I'm having 4 cups of coffee because I don't have enough energy to get throughout the day, your sleep's not good. Evidence is important, but so is experience, and so is feel, and so is the art of treatment. Not everything is 100% broken down into a randomized clinical control trial. There's an abundance of evidence that links occlusion to the rest of the body. It just requires education and a willingness to learn what else is out there that can give our patients the best chance of getting better. This is well documented in literature. One of the main reasons you are sleeping poorly is because you are severely overweight. We're not going to get anywhere if you're not willing to address the root of the issue. Our job is to be honest with our patients for their best interest. Their job is to receive the info and decide what they want to do with it. People know when you're giving them a different quality of service. They know, what can I release from a soft tissue and joint perspective that'll allow their breathing to be better? What can I educate them on in terms of positioning throughout the day, plus when they're sleeping to improve their sleep? What other things can we chat about that might make their sleep better? How does their neck and head feel when they're in the applied, to make sure that there's a nice snug fit between what they're prescribing and what's happening to their head, neck, and the rest of their body. Every job has its physical component that is not conducive to our health. So what you do out of work becomes so much more important. If you work for 8 hours, it's very hard to undo a lot of the quote unquote damage that comes along with it in an hour at the gym. But not doing any of that just accelerates the problems. You need to be moving your body. If evidence made medicine progress, we'd be nowhere, because at some point, someone had to try something that hadn't been tested before to see if it would work.